Welcome to Plastic Surgery T&A. That's Talk and Advice. I am your host, Dr. Earl Stephenson Jr., board certified Atlanta plastic surgeon. And I'm here to give you truth and transformation. So today we're going to pivot a little bit. We're going to talk about another kind of subspecialty expertise that I have, in addition to being an expert in facial aesthetic surgery. I often have found myself during my career taking care of, I hate to use the term, botched procedures because of the show and because of other things. I found myself helping people get back on their path, rewriting their story. So today is a story about medical tourism. And I'm not really here to beat that up a bunch, but I'm really here to kind of walk with you through a journey or down a path with one of my clients, a young client who has roots from her family in Africa, but has family here in Metro Atlanta. And actually, her family has been in my practice as clients, different members of her family for more than a decade. And this young lady, uh, just almost 20, 18 to 20 years old, living in Africa, sought treatment for her breast reduction or a breast reduction in Turkey. Now, Turkey's a hot, hotbed for plastic surgery. So, we're going to get into botched breast surgery abroad, the journey to surgical redemption. Stay tuned.
Welcome to Plastic Surgery T&A. Talk and advice with Dr. Earl Stephenson, board certified plastic surgeon and facial aesthetic expert. Real talk, real results, real transformations. Let's dive in.
Welcome back. Again, this is Earl Stephenson Jr. I'm here to walk you down a path with a patient who, I think rightfully so, went to Turkey for her breast reduction. And why do you say rightfully so? You thought I was going to get up here and beat down medical tourism. I could. And at times I have. But for this patient or this client, she lived in Africa. And so she went to Turkey, which obviously geographically, maybe, and I haven't done the distances, is a little bit closer than coming to the States. But she did have family, close primary family members that lived in the States here in Metro Atlanta. So she certainly could have come here, but she decided to go to Turkey. So we're going to talk about why clients travel abroad. For her, it was geography, but for most clients here in the US, as I look through TikTok videos talking about, oh, I had a fabulous time and I went to Mexico and I went to Brazil and I went to Turkey and all these Facebook, you know, plastic surgery groups. Oh, you go to Turkey. Fine, go to Turkey. The reason people go is because of cost. People are price sensitive. Heck, I'm even price sensitive. But you have to balance price sensitivity with safety. And in my opinion, safety always wins. And with safety, there's value. And with value, there may be higher costs. It costs a lot to run a business here in the good old US of A. It's just the way it is. So, lower cost in other countries such as Mexico, Brazil, Turkey, heck, South Korea are primary drivers for clients leaving the United States and going to those other destinations. And I scratched my head. Yes, the surgery cost is lower in comparison to what you can get as a price point here in the States. You still got to fly, you still have to have lodging. And yes, they have these all inclusive packages. These countries have gotten smart in their marketing and packaging and reduction of friction points, but you still got to travel. You may run up against barriers of language, just logistics of another country. But again, marketing rules. These other countries have gotten smart and they have marketed these as vacation style recoveries. Fine. Hey, it's just part of the game. And so I understand that. Maybe you understand that. We all have to make decisions, but sometimes those decisions go poorly. And they can go poorly here in the States, but at least in the States, you have ways to vet physicians, vet hospitals, vet surgery centers, look at reviews. You understand as best you can the medical system, probably definitely better than you would understand it in Mexico or Brazil. And I hate to say this, you understand the legal system if there, comes a point where you have litigation. You don't understand that in other countries. But again, cost is a driver, and these countries have gotten smart and they market these as vacation style types of packages. And so they reduce friction points. So good for them. But again, what's missing are safety standards. I don't know as I sit here and tell you what the equivalent is right off the top of my head to the American Board of Plastic Surgery in Brazil, in Mexico, in Turkey, in South Korea. I don't know what that is. I don't know how you can find that information out other than surfing the internet. And I don't know how true that is. So I can't tell you what the safety standards here. I think you can certainly get to the bottom of safety standards here in the US much, much more readily than you can in those other countries. A big hang up is post-operative care or recovery care. Again, these countries and these businesses in these countries market to foreigners in Europe and in the States smartly. They've again reduced a friction point. They have recovery style um, post-operative care houses or recovery homes. Again, you don't know the standard of care. You don't who's taking care of you. Is it a nurse in Turkey? What are their requirements? Do you know? Here in the States, you might not know, but you can certainly go to the board of nursing in your particular state or in the particular state that you are, excuse me, seeing your plastic surgeon. You can get that information. So again, safety standards are missing, post-operative care is missing, and I think, and I could be wrong, I don't know, a bit of personalization is missing. You're from the US. You have a comfort level of working with US citizens. There may be a little bit of a lack of comfort working with someone who is from a different country. There may be just a little bit of clumsiness in the interactions. And that could go a long way. There could be miscommunication that could be critical. So again, not that that can happen here in the States. It's just easier to kind of get to the other side of the problem and solve the problem here in a place that you know. So, but nonetheless, this young lady, again, I think recently who lived in Africa, chose to go to, excuse me, Turkey instead of coming to the States where she had resources and family and support. Be that as it may, she did that. And then this patient's experience, she ended up with, I believe, a surgeon or surgeons that provided poor technique, which resulted in an, an inequity in her breasts and a lot of emotional distress. So let's talk about her toll or emotional toll of this bot surgery. So let's pop up her picture before. She comes to my office with her family members who have been longstanding clients of mine, great clients, great people. And she's a young woman, again, not even 20. And this is her result. I want you guys to look at it again. This is her result. It's it looks like a lady in her mid 40s after having children, or a lady in her mid 50s. This is an 18-year-old who is starting to build interpersonal relationships, romantic relationships. This is horrifying. You know, in her consultation, she's just shy, quiet, hunched over. She wasn't really just looking for a revision. That's obvious. So she needed someone to really sit and listen to her story. And so we did. We sat with her. I listened. I listened to her family members tell me about her journey after this. Yes, her breasts were much heavier before this result. Yes, is it improved? But you know, you can improve it, but the goal is not only improvement, but it's aesthetic. There are aesthetic principles and results that have to be achieved with the reduction in size for this particular case, a breast reduction. The aesthetics count, and especially in a lady who's just beginning her journey as a woman. I mean, you can't blow this. You just can't botch this. So, what are the challenges here? Again, let's look at the picture. She's got hyperpigmentation of her healed incisions. She's needs, her areola resized. They're of different shapes, and I know areola are identical, but these are ridiculously opposite. The lower pole or the lower portion of her breast beneath the nipple is mismatched. One is fuller and longer, one is not. She needs recontouring of that. She needs tightening, more tightening of her skin. It's loose. The skin envelope, just like an envelope that you would put a letter in, the covering of the breast tissue needs to be tightened. And that not only can be tightened by removing the appropriate amount of skin with the appropriate amount of expertise, technique, and craftsmanship, if I could use that word, to give her a nice contour. And of course, she needs revision of her healed incisions so that we can manage her hyperpigmentation by producing stitch lines that close that aren't under stress, aren't under tension. You know, in people of color, we certainly don't want this because it can produce hyperpigmentation. It can produce actually even hypertrophic scarring or keloid formation, especially if people have a genetic propensity to form keloids. So, careful handling of the tissue. You just don't grab it and pinch it and put big stitches in and be really rough with it. You have to be gentle. You have to be thoughtful about where you put your stitches, how many stitches are enough. There's no right or wrong answer. That's experience. You got to make sure that the incisions are lay together very easily, not forced together. That's experience. You can't be rushed. You can't be slow. You have to be efficient and thoughtful. This surgery in Turkey, I believe, took them, and I asked specifically because I was horrified, an hour and a half. Now, I'm all about getting things done. Surgeons are all about getting stuff done and being, quote, quick or fast. It's not about speed and movement, it's about efficiency and processes that get you from beginning to end in an efficient manner. I know a lot of surgeons. I'm not the slowest for sure. I'm not the fastest for sure. But I don't know any surgeon that can do a breast reduction of significance, taking off a pound and a half, 2 pounds, 4 pounds on each breast in an hour and a half. I just don't know anybody. So again, this was just, I hate to use the term slice and dice. We got to get them out, get them in. We've charged them X amount of dollars. We've overbooked ourselves. We got to run this machine with volume because we're charging so cheaply so that we can make a profit. So we got to pack them in like tuna and we got to churn them out as opposed to getting value for your time, for your safety, for your result by being seen by someone who is going to give you their expertise, give you their time, be thoughtful, be efficient to give you a safe, beautiful result. There's the value and that cost. Just like if you want to drive a Yugo, it gets you from point A to point B, that's fine. If you want an experience and be able to also drive from point A to point B, and you want a luxury car, take your pick, you're going to pay more. Your experience is going to be different. Your emotions and happiness will be different. So you pay for that value. So, long story short, we need to reposition her areola. I need to recontour and make her lower poles of her breast equal. I need to tighten her skin to reshape, remove the right amount of skin, creating incisions that lay very nicely and easily together to give her a youthful shape and minimally seen healed incisions. So that was our plan. We aren't just surgeons. This lady has a story to tell. We want to help our clients reclaim their story. She doesn't want this to be her story or part of her story moving down through her life. We want her back with her original draft of her story. So, long story short, I did her revision. Here's the result. Now, she's probably, I'm going to say, 2.5 weeks here. Her incisions are better for sure. They're going to get miraculously better over the next 11 and a half months. Her shape is very nice now. It will settle a little bit and look softer and more supple, but certainly miles different than the original before picture. Her areola, and I can't really show areola, of course, on in video. I'll get sanctioned by social media platforms. But her areola, you'll have to take my word for it, are symmetric and they have a nice circular shape as opposed to oblong and all kinds of hideous shape. So we gave her back her story. And now, yes, she has healed incisions as an 18 or 20-year-old or a young woman, but she can start her journey to womanhood proudly and confidently as opposed to before she sought treatment by me. So, you know, again, I didn't set out to be a revision surgeon, but I've ended up in my journey as a board certified plastic surgeon helping people rebuild their confidence by reclaiming their story. And so Here are some red flags if you have had breast surgery, specifically in this case, a breast lift or breast reduction without implants, that you might consider or might look at and reevaluate if you are unhappy and you feel that you're not living your best life in regard to this result, that you should take into account nipples that are too low or asymmetric, nipple aneurysma that are too high, where you can see it at the top of your deeply cut top or bra, breasts that look like they bottom out, and I call them rocks in socks, scars that are wide, discolored, especially if you're a patient of color, client of color, or even you're not, scars that are wide and pink. Um, if you do have implants, implants that have shifted beyond what I believe are would be reasonable. The implant sits way too low. The implant sits way too high. The implant sits way too lateral or widely when you're sitting up, and definitely way too widely when you're laying down. Implants have a natural drift out to your armpit a bit when you lay down, but they shouldn't be in your armpit. So if you have any of those problems or combinations of problems, these are red flags. Whether this is done in Turkey or Texas, doesn't matter. You can't ignore the dissatisfaction. You can rationalize it either because you just don't want to go down the journey, or you can rationalize it that financially it doesn't make sense for you because you've already spent the money. But our happiness internally is important. And if you feel that this is making you unhappy, then this is something you should investigate. Revision isn't shameful, it's really brave. You know, I try to encourage those who've had disappointing results, even some of my own patients I've encouraged. Of course, that we've gotten results that we didn't anticipate. I'm disappointed. So I'm all in. But again, revision isn't shameful. It's really brave of you to seek out that expertise. Your body isn't ruined, it's ready for redemption. So, really brief podcast today, but a really, I think, powerful podcast because people pay a lot, whether you're in the States or heck, whether you're overseas. They pay a lot in time, they pay a lot in effort, they pay a lot in discomfort, missed work, and you want to be happy with your results. And if you're unhappy, you are afraid that there are answers, or you don't want to spend the money again, or you can't spend the money, or whatever, there there are solutions, and you should, in my opinion, at least seek out the solutions. Now, you may ultimately decide not to, but know that there are possible solutions to your disappointing results. And if you travel overseas, especially from the States, there's really no need to. I'm going to say something really harsh that a lot of people are not going to like. Plastic surgery here in the States is expensive. I understand that. Sometimes you just can't afford it. You know, I live in Atlanta. There are certain areas of Atlanta that are very exclusive. I can't afford to live there. There's certain cars that people have that you would like to have, but you can't afford it, and it's okay. And you make do what you have. And I'm not saying that in the point of revision, but if you seek plastic surgery with before and never had it before, and you can't afford it, it's understandable. There are solutions for that. There's financing, and then there's just good old fashioned saving. If it really bothers you and you really want it done, and it is plastic surgery is really powerful. People will poo poo it because you're being vain. You should always make the biggest investment in you or your children, but you should always make the biggest investment in you. And so, if you really feel that you want this, don't take the cheap way out because it ends up being the most expensive way, especially if you get a bad result. Now, you get good results in other countries. A lot of times that may be just good fortune. A lot of times it's because a lot of these surgeons trained in the US. They trained here and then went back home, or they went to a country where they desired to live. So that's good fortune again. But here in the States, it's easier to navigate the systems. And yes, it's expensive. And if you can't quite afford it at the time, doesn't mean you can't afford it ever. You may have to build in a financial plan. So, again, the final takeaways here are really simple. Seek out board certified plastic surgeons that, in this case, may be culturally attuned to potential problems, who have the expertise to give you solutions to the concerns you may have, whether that's you've never had plastic surgery before or you've had plastic surgery and you've had a disappointing result. The American Board of Plastic Surgery is a great starting resource. It's a simple website, and I'll put it up right here so that you can see it. There's the web address right there. You can go to the American Board of Plastic Surgery. You can look up my name. You can look up the name of the surgeon that you're interested in, who has what you believe the expertise to help you tell your story. If you're interested in specifically working with me, because again, I've found myself falling into this niche of helping people, if I can help them with redemption as far as disappointing plastic surgery, then it's really, really simple. You just call my office, 770-466-4700. My team member will answer all your questions. We do require a $225 consult fee. And that's a minimal investment if you're serious. If you feel that your problem or your concern warrants expertise and you're serious about it, then this is a small investment moving forward to get what you desire. So we we request a $225 fee, and we spend time with you. We don't rush you through. We make sure that we understand your journey, where you are, where you want to go, and how reshaping your story, how we can help you do that. If you're not quite ready, then I understand you want to check me out a little bit more. You've got a couple of options there. You can definitely just email me, ask me questions or my team questions. There's the email there. You can always just go to my website and just peruse it. I try to be thoughtful again and try to think about questions that you may have. We have a robust FAQ section. We try to have, reasonable before and after pictures, descriptions of the procedures and what to expect before, during, and after, about information about myself, the practice location, about my team, again about finances, if that's something you want to consider. We try to make the website not only beautiful but really informative. We don't want it to be just another pretty face. We want it to be smart and beautiful, just like you, smart and beautiful. So that's how you can connect with me If you think you have some of these red flags, or you don't really know if you're ready for a revision, even though you know you have red flags, you can download my free revision readiness checklist. Just go to my website again, click on the contact us page, type in your information, and say, I want the readiness revision checklist, and we'll send it out to you. And you can just simply go down that checklist and see if you, by meeting the criteria, are ready. And it just requires a conversation. You may decide to work with me. You may decide not to work with me. You may decide to work with someone else. You often hear me say this. My job is to give you information so that you can make the best decision for you. And on that note, another Saturday podcast is done. Again, I really appreciate you watching Plastic Surgery T&A. Our membership or subscriber number is growing. We like to continue that momentum. And what you can do for me, if this is the first time and you like what you see, I just ask you to subscribe. If you've been multiple times and you haven't yet subscribed, do me a favor. Just subscribe and you hit the bell icon, and you'll get updates when I post new videos. Watch them on your own time. So, again, it really helps me grow the channel, and the channel is starting to grow. And so we want to keep that momentum so that I can bring you better information. I can use better, I would say props, but better material so that you can get a better visualization of what we're discussing and what could be impactful for you, or maybe someone you love or someone you know. So, on that note, thanks for tuning in. We'll see you guys again next Saturday at 11 Eastern Standard Time. Until then, be healthy, wealthy, and wise in all things. Peace.